Nanomedicine for respiratory diseases. Nanomedicine is an evolving field that combines nanotechnology with medicine to develop innovative approaches for diagnosing, treating, and preventing diseases. In recent years, significant advancements have been made in the application of nanotechnology in respiratory medicine. This script aims to provide a detailed understanding of the various aspects of nanomedicine for respiratory diseases. We will explore topics such as the anatomy and physiology of the respiratory system, the pathophysiology of respiratory diseases, nanoparticles and drug delivery systems, targeting strategies, inhalation nanomedicine, nanotechnology-based imaging techniques, nanotoxicology and safety considerations, nanotheranostics, biomaterials and tissue engineering, nanosensors and biosensors, and finally, future perspectives and challenges in the field of nanomedicine for respiratory diseases. Nanomedicine has revolutionized the field of healthcare by enabling the precise targeting of therapeutics to specific sites within the body. In the context of respiratory diseases, nanotechnology offers tremendous potential for improving drug delivery, enhancing diagnostics, and promoting tissue regeneration. By engineering particles at the nanoscale, it is possible to overcome the limitations of traditional medications, such as poor solubility, low bioavailability, and lack of specificity. This introductory section lays the foundation for understanding the applications of nanomedicine in respiratory diseases and sets the stage for further exploration. To fully comprehend the intricacies of respiratory diseases, it is essential to have a comprehensive understanding of the anatomy and physiology of the respiratory system. The respiratory system includes various structures, such as the nasal cavity, pharynx, larynx, trachea, bronchi, and lungs, which work synergistically to facilitate the exchange of oxygen and carbon dioxide. An in-depth exploration of the structure and function of these components will shed light on how nanomedicine can effectively target and treat specific respiratory conditions. Respiratory diseases encompass a wide range of conditions, including chronic obstructive pulmonary disease, COPD, asthma, pneumonia, and lung cancer. Understanding the pathophysiological mechanisms underlying these diseases is crucial for the development of effective nanomedicine interventions. This section will delve into the cellular and molecular changes that occur in various respiratory diseases, exploring the underlying causes, progression, and potential targets for therapeutic interventions. Nanoparticles are at the core of nanomedicine for respiratory diseases. These tiny particles possess unique physicochemical properties that can be tailored to suit specific therapeutic applications. By encapsulating medications within nanoparticles, drug delivery systems can overcome the barriers of mucociliary clearance and facilitate the targeted delivery of drugs to the desired site within the respiratory system. This topic will explore the different types of nanoparticles utilized in drug delivery systems, their formulation strategies, and their advantages in treating respiratory diseases. Targeting strategies play a pivotal role in enhancing drug specificity and efficacy while minimizing off-target effects. In the context of respiratory diseases, the development of targeting strategies can significantly improve drug delivery to the affected region, thus maximizing therapeutic outcomes. This section will discuss various targeting approaches involving ligand-based targeting, pH-responsive systems, and stimuli-responsive nanoparticles, providing insights into their mechanisms and potential applications in respiratory medicine. Inhalation route of drug delivery holds great promise for treating respiratory diseases, as it allows for direct administration of drugs to the lungs. Inhalable nanomedicine formulations offer advantages such as prolonged residence time, enhanced drug deposition, and improved patient compliance. This topic will explore the different types of inhalation nanomedicine formulations, their mechanisms of action, and their potential to overcome the challenges associated with conventional inhalation therapies. Imaging techniques play a crucial role in diagnosing and monitoring respiratory diseases. Nanotechnology-based imaging modalities offer improved sensitivity, selectivity, and spatial resolution, enabling early detection and accurate assessment of disease progression. This section will delve into advanced nanotechnology-based imaging techniques such as magnetic resonance imaging, MRI, computed tomography, CT, positron emission tomography, PET, and optical imaging, highlighting their applications in respiratory medicine. With the increasing use of nanomaterials in medicine, it is vital to address the potential toxicological effects and safety considerations associated with their use. Nanotoxicology investigates the interactions between nanoparticles and biological systems, aiming to identify potential risks and develop appropriate safety guidelines. This topic will explore the unique properties of nanoparticles that contribute to their toxicity and discuss the current challenges and strategies in assessing and monitoring the safety of nanomedicine in respiratory diseases. Nanotheranostics is an emerging field that combines diagnostics and therapeutics in a single nanoscale platform. By integrating imaging and therapeutic functionalities, Nanotheranostics enable personalized medicine approaches for respiratory diseases. This section will discuss the development of multifunctional nanoparticles capable of both diagnostics, such as imaging and biosensing, and therapeutics for simultaneous diagnosis and treatment of respiratory conditions. Biomaterials and tissue engineering offer innovative solutions for restoring or replacing damaged respiratory tissues. By combining nanotechnology with these disciplines, it is possible to fabricate scaffolds and bioactive materials that promote tissue regeneration and functional recovery. This topic will explore the applications of biomaterials and tissue engineering approaches for respiratory diseases, providing insights into their potential for restoring lung structure and function. Nanosensors and biosensors play a pivotal role in monitoring and assessing respiratory diseases, providing real-time and sensitive measurements of specific biomarkers. By integrating nanotechnology with sensing technologies, it is possible to develop highly sensitive and portable devices for point-of-care diagnostics and remote monitoring of respiratory conditions. This section will delve into the principles of nanosensors and biosensors and discuss their potential applications in detecting and managing respiratory diseases. As the field of nanomedicine for respiratory diseases continues to evolve, several challenges and opportunities lie ahead. This final section will discuss the future perspectives of nanomedicine, including advancements in nanomaterial design, personalized medicine, and the integration of artificial intelligence. It will also shed light on the challenges associated with clinical translation, regulatory approvals, and ethical considerations, providing a holistic understanding of the current and future landscape of nanomedicine and respiratory diseases. In conclusion, the application of nanotechnology in respiratory medicine holds immense potential for revolutionizing the diagnosis, treatment, and prevention of respiratory diseases. By enabling targeted drug delivery, enhancing imaging techniques, and facilitating tissue regeneration, nanomedicine offers a promising avenue for improving therapeutic outcomes and patient quality of life. However, several challenges related to safety, clinical translation, and regulatory approvals need to be addressed for a seamless implementation of nanomedicine. With continued research and collaboration, nanotechnology is poised to shape the future of respiratory medicine and pave the way for personalized and effective healthcare interventions.